from the view where I stand, which is about 18 inches higher than you right now, we have these great partners in this field, in education, in mental health, in child welfare, in health, and in other areas. And that hasn't always been the case. You know, I started listening to some of the conversations. I've met some of you in the room years ago, and it was very difficult to set the table with the array of partners. There were some model efforts in Placer County and elsewhere. There were some really neat things happening at the county level. But we didn't see the kind of state-level engagement and broad community engagement around these partnerships that we do today. Doesn't mean everybody's on board. But we're so farther along that process today than we were 5 or 10 years ago. Second, there's this incredible richness of funding in California. Again, you may feel like your wallet is empty, but in terms of education dollars, the mental health dollars, the health dollars, other funds that we have, other states drool at the prospect of the money that we have here in California. I gave a presentation in Mexico at an international conference, and the head of mental health for China came to me and said they didn't have as much money for mental health as we have in California. China, right? There's this incredible resource that we have in the funding streams that we have in here in California. Again, it may not feel like it's enough, but it is tremendous compared to where we used to be. The Mental Health Services Act alone generates about $2 billion a year in funds that were not available prior to the act. We have this research and learning capacity in California from the University of California and California State University and USC's and Stanford. There are hundreds and hundreds of research centers in California that are really ready and interested, and they want to get engaged, and they want to figure out how they can partner and be productive. Right? I'm not suggesting that we're using those yet, but the resources are there. We have the political and community leaders who are engaged. There are foundations and local electeds and state electeds and corporate and community partners who, after years of talking about this, have really come to understand how important it is to invest in children. And I'll tell you just one quick example is we've been working with the tech sector around innovations in mental health, and Google has offered to co-host for us an innovation summit. And there are 5 other tech companies who've said, how can we help? And we've said, we want your brains, we want your ideas, we want your support, we want your political capital. And they've said, tell us when and where we need to show up. And one company has tentatively offered $125 million in a donation, with the ability to match that from other private sector donations. And so we have this incredible array of political and community leaders who are engaged in ways that they have not been engaged even a year ago. And on top of that, we have the creative sector, the technology sector, data, artistic, spiritual, and management leaders in California that is unrivaled anywhere else in the world. Incredible resources at our disposal. This big toolbox, or since we're talking kids, this toy box, that if we just reach into to start to pull out some of these toys and these tools and take advantage of those, this is unprecedented in terms of other states, other countries, and periods of time. I haven't seen the level of attention and interest around children and families in the more than 20 years that I've been watching policy and participating that I'm seeing now. And so it's an incredible opportunity. I also want to tell you that this is about breaking barriers. And just to remind you that every rule that you're bumping up against, every funding constraint, licensing rule, citing requirement, law, regulation, or other barrier, we made. Right? This isn't about, we're not looking to change physics. Right? We're not trying to figure out, I read this article the other day about how they can actually build structures on Mars with Mars soil. Right? I mean, they're doing soil science to figure out how to build buildings on Mars so we can build houses there. We don't have that problem. Our problem is a self-made problem, which means you all can figure out how to fix it and we can get it fixed. If it's not in the U.S. Constitution, we can change it. We just have to figure out what we want. And we have to figure out how we bring together all of that political capital of these partners who are sitting around your table to do that. So that's all the good news, that we have the possibility to do this with the things that are at our disposal. I'm not saying it's easy, But I'd also say that there aren't any great secrets here. It's classic, we need to set high-level goals, right? The dissonance, that uncomfortableness, those goals need to be high enough that we're a little uncomfortable about how we're going to get there. And we need some strategy, and I'm going to take some cues from the Mental Health Services Act because I think it is this brilliant body of policy. What gets me excited about the Mental Health Services Act isn't the money, it's the policy. It mandates that we focus on prevention. It's only 20% of the funds, but it's $350 million per year. We push counties to spend that money across 3-year plans. We have $1 billion in California just in mental health for prevention and early intervention. This is something other states can only dream of, right? And it says, if you want to get in front of this problem, we really have to think strategically about prevention. Now, I would suggest we don't have a strong prevention strategy around mental health, right? We've done more for prevention on obesity. We've done more for prevention on preventing garbage from accumulating in our streams and waterways, right? Davis just passed an ordinance prohibiting the styrofoam things that don't degrade, right? It's a prevention strategy, right? I think we have not even begun to think about what are the prevention tools that we can deploy for children and families. On obesity, we've changed the way we label food. We've required every child to take PE. We've required every child there's a presidential fitness test. My kids just took it, and they said that the bar was too low, right? How many of you wear a Fitbit? People are making money off of obesity prevention now. We figured out how to incentivize you to get engaged, right? So what's the equivalent prevention strategy for us around meeting the needs of children and families? We can do this, particularly if we can start thinking about how you do it in a way that somebody's making money to help us actually stay fit. Brilliant, right? Let's get the incentives down. We really need to do early intervention. Early intervention is the key, right? And again, I would say even in the mental health space, we haven't figured that out just yet. We've got the money, we know how to spend the money, but we haven't had this collective conversation. Under the Mental Health Services Act, you and your community are supposed to design your community mental health plan. How many of you participate in that process? Okay, so I'd say 10%. Where are the other 90% of you? Right? How many of you are child welfare? How many of you know that the Mental Health Services Act says these dollars need to be used to reduce out-of-home placements? Are they being used for that? Some. I see one head nodding, right? In Placer County, it looks like, right? Shasta also. And in Shasta, right? And so one of the questions that I ask all the time is, what did you learn from what the county next door is doing? Why is this so hard, right? That's that technical assistance and support, right? How many of you work in education? Again, so half of you. Reducing school failure is one of the goals of the Mental Health Services Act. How many of you are partnering, who are part of the community planning process? Placer's like, yeah, we're doing that. Yeah, that's why Placer's at the front. Sounds like, right? So one of the things that's challenging is there is brilliance going on in California. There's phenomenal things going on in California. There are almost no problems we don't know how to solve. The problem is we're not connecting. We're not learning from each other. We're not communicating well enough. And I'd say half of the challenge is shining a light on the things that are working really, really well. And the other half is Carla's admonition, it's not enough. It's not enough.